All right, switching gears, pharmacy giant CVS Health won a bidding war to acquire at-home care leader Signify Health. That deal is valued around $8 billion. And this is the latest move from the drugstore giant to become an integrated healthcare provider. Columbia University's healthcare policy professor Megan Fitzgerald joins us now. And Megan, what can you tell us some of the details about this deal?
Well, I think it's a deal that's right down the fairway for CVS. Remember, they're a healthcare insurer, they're a PBM, and they're a retailer. They also have the Minute Clinic. So Signify gives them 10,000 physicians and about over 2 million home care visits that they can conduct. So it's a great extension as CVS aspires, and everyone else does, to move care into the home. It's a lower cost setting. It's more convenience for patients. And where appropriate, it's really where patients want to be seen. So I think CVS is a great owner for this asset. I think they're getting a great team. And they're also now allowing themselves to have a lot of revenue synergy across their book of business. It's also why they said the deal is accretive next year.
You know, Megan, we focus a lot, obviously, on what all of this means for companies that are making these moves, for CVS in this case, as you just talked about. I'm also curious, as we see more and more consolidation here by the likes of CVS, by the likes of an Amazon, or United Health for that matter, what does all of this mean for patients? Is all of this good for patients?
It should be, Julie. I mean, having your data and a trusted provider understand the continuum of care, where you're being treated, what you need, whether you went to the emergency room. Is it better that Julie is treated in the home? Is it better that she gets a telehealth visit, or does she need to come into the hospital? Can she do her pre-op at home? So I think having patients under management, if done correctly and prices don't go up, this should be a better value for you.
Those are some big ifs there, Meg.
Yeah, fair point. But I think some of the data shows that care in the lower cost setting is better for you. And oftentimes you get lost. How often have you tried to find an x-ray or bring it with you and you can't? So by having you on one platform and serving you across all of your healthcare needs should make a difference. And I believe eventually that it will.
Megan, I got to tell you, I can't remember the last time I physically touched an x-ray, but I kind of remember what that's like. I want to talk to you about Amazon and Jeff Bezos. I remember a letter he wrote to shareholders years ago. He talked about failing at scale, and he's had a few high-profile events like that. Now, Amazon Care shut down, but you're saying they learned a lot of lessons from that, and maybe that's going to apply to their potential acquisition of One Medical.
Yeah, I think Jeff Bezos gave Amazon a 30% chance of success, if I remember. So good memory by you. Amazon is amazing at failing fast and figuring things out. So it was no surprise that they would shut down Amazon Care, especially since they bought One Medical. I think what they've learned, and you have to remember, they're one of the largest providers of healthcare in the nation because they're one of the largest employers. So healthcare is not only a cost, it's an opportunity. And I think what Amazon realizes, they're really good at communicating with consumers, and they're really good at delivering things. So it makes sense that they would want to do telehealth, virtual care, and then also add an asset that can provide inpatient care when needed. Back to the discussion we just had, sometimes telehealth is not enough and you actually need to see a physician. One Medical is in over 25 locations. So I think One Medical and their experience gave them the confidence that this is the path they want to take in healthcare, which is why they bought this asset. They also have a partnership with Ginger in mental health. They also have PillPack. So there's a lot of assets now that they can now direct and hang on to One Medical to do what they do best. So I think that was the right deal for them, and Signify was the right deal for CVS.
Now, I know, Meg, you're not an Amazon analyst per se. You're focused on healthcare, but does Amazon's actions in this area make it more attractive? Is this going to be a really profitable business for them?
It's so tiny. I don't even think it registers when I listen to the earnings call. I think healthcare is like under 1% of value. So I think just like, groceries and books and other things, this is analogous to web services to me. This was a need for them. They got into the business of web services, and now it not only serves them, it's now a profitable and lucrative line of business. I think healthcare may take the same path. They're going to have to do other acquisitions. Remember, with a 1.3 million market cap for Amazon, they could probably buy anybody in healthcare in the Fortune 500 should they decide to do that.
And Megan, we got time for one more. I want to ask you about nasal administered vaccines. This is something you talked about with our own Anjali Kamlani about a year ago. Any updates on that front?
Yeah, there's 20 products in clinical trials for nasal vaccines. Makes a lot of sense, right? It's easy. People that don't want a shot also might be something we can transport to other countries that have trouble with logistics. So there's 20 in clinical trials. There's 4 on the market right now. I think all and others in public health will be looking to see what the data and efficacy is. Can a local administered mucosal vaccine give you the same level of efficacy as one that you inject in the arm? It's about a fifth of the dose. So I think looking at the data out of Russia, Iran, and a few other countries will be important. The U.S. is about 2 years out from having them on the market here, and it doesn't seem like we're in any rush for boosters, given that 48% of the eligible population has received their booster.
And you got to think that sniffs over jabs going to be a big winner when they eventually do come and hit the mass market. Columbia University's Megan Fitzgerald, thank you for joining us this morning.